welcome you all to this session on hormonal contraception. I am Professor Balogun Olayinka Rabiu of the Department of Obstetrics and Gynecology, University of Ilorin. With this discussion, I want to highlight the following. 1. The meaning of contraception, the available methods of hormonal contraception, efficacy, contraindication, and instructions for use. We shall also discussing about hormonal contraception for men. What is the meaning of contraception? Literally, contraception means interception in the birth process at any stage ranging from ovulation to ovum implantation. An act or device whose purpose is to prevent pregnancy is described as contraceptive. For hormonal contraception, which is of course supposed to be the biggest form of contraceptive artificial practice, is into many areas, and apparently hormonal contraception is one of a contraceptive method that has many applications. Some are orally induced and are called oral contraception, and some are non-oral contraceptive practices. Of course, for oral contraceptive practice, you have the combined oral pills, which is otherwise called the OCPs. And you also have progesterone-only pills, which is also referred to as mini pills. For the non-oral contraception, of course, we have the injectable, which is one of the most common form again. And for the injectables, you are aware that you have the 3-monthly injection, which is called the Depo-Provera medroxyprogesterone acetate injection, and we have the 2-monthly injection, which is called the Noristerat, which is sterone. Of course, we have the transdermal patches. By transdermal, we mean is applicable to the surface of the skin and is absorbed from the surface of the skin. And of course, we have the implants that are inserted into the subcutaneous parts of the body. And the intrauterine system, which is, those are hormones that are, copulated with the intrauterine contraceptive device. And of course, vaginal rings. Vaginal rings are also devices that are also impregnated with hormone substances and are slowly released from the, into the vagina and are absorbed from the vaginal walls. The oral contraceptive pill apparently is the most popular and highly effective reversible form of contraceptives. Why is it popular? Is it popular because it does not require the intervention by a health worker? It can be purchased over the counter and can so be used by patients. 99 to 99.5% success rate if used appropriately. It is a combination of estrogen and progestin. It may be monophasic, biphasic, or triphasic preparations. We will soon come to understand what these terms are. Ethinyl estradiol 30 microgram and nogestrel 300 microgram. Ethinyl estradiol 30 microgram, levonorgestrel 150 microgram. Ethinyl estradiol 30 microgram and destrogel 150 microgram are such preparations that you're going to find a majority of the oral contraceptive pills. By monophasic pill, what we mean is that all the various tablets that constitute the monthly package have the same estrogen and progesterone composition for all the 21 days. This is usually the preferred type, and is the commonest types that you have in most places. The biphasic have fixed dose of estrogen for 21 days. However, with increasing doses of progesterone during the 2 successful phases, that is, first 10 days and the second phase of the next 11 days. Triphasic, the dose of estrogen may be fixed or variable while the dose of progestin increases in 3 equal phases, that is, every 7 days for 21 days. What is now the difference between these phases? Monophasic have the same type of tablets. Biphasic, for the first half of the menstrual cycle, the dose of estrogen and progesterone differs from the second half of the cycle. And in triphasic, that means the cycle is divided into 3 equal parts. The first, 1/3 have the same type of concentration, different from the mid-third and the large third. It's the triphasic that tries to mimic, the diurnal variation in human body. Mechanism of action of oral contraceptive pills is the suppression of ovulation by inhibiting the release of follicle-stimulating hormone and luteinizing hormone. This action is mainly estrogenic effects. Disruption of proliferative and secretory phases of endometrium reduces the chances of implantation of ovum is mainly the action of the progesterone. And the progestinic effect also increases the viscosity of the cervical mucus. And the implication of increase in viscosity of the cervical mucus is that it reduces the ascent of the spermatozoa into the upper genital tract and making it difficult for it to get to the conception sites. Advantages of oral contraceptive pills are: 1, they are very highly effective, they allow good cycle control, and they provide non-contraceptive health benefits. The non-contraceptive benefits of oral contraceptive pills will include: 1, improvement in dysmenorrhea, improvement in hirsutism and acne. They try to reduce blood loss, especially in patients who have dysfunctional uterine bleeding, symptomatic uterine fibroids, and also regulates menses and comes regularly, predictably. And of course, they also improve endometriotic symptoms. It also provides lower risk for endometrial cancer, for pelvic inflammatory disease and ectopic pregnancy, and functional ovarian cysts. Side effects of oral contraceptive pills. The minor side effects will include breast tenderness, elevated blood pressure, nausea, bloating, headaches, vertigo, bleeding, withdrawal, breakthrough, and of course, some patients may present with amenorrhea. Presentation of diabetes in patients who are prone and who have first-degree family history of diabetes. So, if you are prescribing OC pills for patients who have a family history of diabetes, you should be extremely careful, and you must ensure that regularly such patients are screened for their blood sugar. Minor weight gain can also be a problem for patients who utilizes oral contraceptive pills. We have some severe side effects. If when they occur, it gives you the alarm that oral contraceptive pills should be discontinued. And these include thromboembolism, myocardial infarction, cholestatic jaundice, cerebral thrombosis, gallstones, and hepatic adenoma. So that means in patients who are, on oral contraceptive pills, you must be on the lookout for some of the telltale signs of these symptoms. And we have absolute contraindication to use of oral contraceptive pills. And these include smoker over the age of 35 years, people who smoke more than 15 cigarettes per day, blood pressure elevation, blood pressure 160 millimeter of mercury for systolic, and diastolic of more than 100 millimeter of mercury, current or past history of venous thromboembolism, and patient with history of ischemic heart disease should not be allowed to use oral contraceptive pills. They should be discouraged, and alternative methods must be sought for them so that they can also benefit from birth control. Absolute contraindication also include patients with complicated valvular heart disease, history of previous cerebrovascular accidents, migraine headache, breast cancer current or treated, diabetes with retinopathy, nephropathy, or neuropathy, and patients with liver disease should be discouraged from taking oral contraceptive pills. Relative contraindication will be people, smokers who take less than 15 cigarettes per day, diabetes who are adequately controlled, obesity, mild obesity can also take it, migraine headache over the age of 35 years, you can consciously use oral contraceptive pills. Gallstone disease that is currently asymptomatic can also be allowed. And use of drugs that may interfere with oral contraceptive medication should be avoided. Of course, several preparations are available. Of course, we are all familiar with microgynon, levonorgestrel, 150 microgram, and nitinol estradiol, 30 microgram, while the last 7 inactive components consist of ferrous sulfate. Some inactive components may be lactose or sucrose in formulation, but majority of the ones we have around here have ferrous sulfate as the active tablets. Of course, the progesterone-only pills all appear similar, and they contain progestin only. The available preparation are norethindrone, 0.350 milligram, and you have the levonorgestrel, 0.007 milligram. You have the norgestrel, 0.03 milligram, and the acetate, 0.5 milligram. These are some of the formulations that you can have in mini pills. Mini pills are highly sensitive to user error, so therefore, patients must be adequately counseled to take it regularly and at about the same time. Lower success rate compared to combination pill because progesterone is not a too active inhibitor of ovulation. So a patient who take only mini pills can also have a breakthrough ovulation. And if they have breakthrough ovulation, that means the system can fail. Pills may be given soon after delivery as opposed to oral contraceptive pills, which is given far into the puerperium, about 6 to 8 weeks after delivery. But in mini pills, they can be used from the beginning. And of course, mini pills can be given where estrogens are contraindicated. Indications for mini pill use are lactating women, women who are aged over 40 years, sickle cell disease patients, patients who have seizures, and patients who have past history of thromboembolism and who insist on taking oral medication. Oral contraceptive medication can be counseled to use the mini pills. Mechanisms of action of mini pills. 1. It thickens the cervical mucus, which becomes the main action. It thins the endometrial lining, and once this is done, it discourages implantation of the zygote. And of course, it alters tubal motility, making it very slow to move. And this is also the reason why they also say mini pills can predispose to ectopic gestation. It prevents ovulation by decreasing the genital rate pulse frequency and prevention of mid-cycle luteinizing hormone and follicle stimulating hormone surge. Of course, the side effects include irregular menstrual bleeding, breast tenderness can also occur, headaches, acne, decreased libido, depression, and altered carbohydrate metabolism can occur. Injectable contraceptives, long-acting progesterone derivative. The route of administration is either intramuscular on deltoid or the gluteus muscles. And preparations include Depo-Provera, which is depo-medroxyprogesterone acetate, which has a half-life of about 90 days, which is equivalent to about 3 months. And we have the non-steroid, which is non-ethinyl which comes in 200 milligram ampoule. And the half-life of non-ethinyl is 60 days. That means the injection must be repeated after 2 months in patient who needs to control to enjoy the effect of the non-steroid. Depo-provera is every 3 months. Non-steroid is every 2 months. This is the ampoule for the Depo-provera. Mechanism of action same as mini pill, and is used where compliance is a major concern, where you cannot be too sure that the patient will remember to take this piece on a daily basis. It is highly effective and is convenient, given every 2 to 3 months, and the side effects is also similar to what we before discussed with the mini pills. The implant is also a hormone contraceptive. It's progesterone based and is inserted subdermally. Of course, we have several types. We have the Norplant 1, which contains 6 flexible capsules, each containing 36 milligrams of levonorgestrel. Of course, we have Norplant 2, which is also contains 2 elastic rod seeds containing 70 milligrams of levonorgestrel. Both of these, Norplant 1 is effective for 5 years. Norplant 2, which contains 70 milligrams, is effective for 3 years. Today, we have Jadel, which is just 2 flexible rods containing 75 milligrams of levonorgestrel, but is effective for 5 years. Nexoplanon, which is a single radio-opaque, containing 68 milligrams of etonogestrel. Of course, it's also called Implanon, and of course, it's effective for about 3 years. This pictorial represents, the way implants are deposited subdermally. This is being done in the medial side of the arm, and of course, on the left side, we have the applicator, and on the right side, you have the provider trying to, deposit the rod into the subdermal area in the arm. Transdermal patch. These are also known as contraceptive patch. They contain both estrogen and progesterone. It is as effective as oral contraceptive pills with perfect use. Weekly application encourages compliance, and serum concentration is not affected by exercise, by heat, by cold, or immersion in water, and is applied every week for 3 weeks, then a week without the patch, which allows the patient to menstruate. This is the transdermal patch. What it does is that this is attached to the skin, either in the lateral side of the upper arm, and of course you can have side reaction at the site of the application. Levonorgestrel intrauterine system is safe, it is effective, it is marketed in the United States of America as Mirana, and it is inserted within 5 days of the menses. It contains 52 milligrams of levonorgestrel and releases 20 micrograms of this substance every 24 hours into the endometrial surface, from where it is absorbed into the body system and is effective for 5 years. It is also worthy of note that this system also used for the treatment of dysfunctional uterine bleeding in the developed world, and it of course is highly effective in reducing blood loss at menstruation. Vaginal rings is a soft ring, plastic ring that is placed inside the vagina, marketed as Nova rings, and it is impregnated with both estrogen and progesterone. It is inserted into the vagina within 5 days of the menses and releases etonogestrel 120 micrograms plus ethinyl estradiol 15 micrograms per day. This is vaginal ring. It is used for 3 weeks and removed for 1 week, just like we have in the transdermal patch. Absorption to the bloodstream is through the vaginal epithelium. It's very effective and reversible method. Emergency contraception. By emergency contraception, we mean those are the agents that can be used in such patients that have unprotected sexual intercourse unintended sexual intercourse, and for some of these things, you can have such situations in rape. We prevent pregnancy after unprotected sexual intercourse, and it's also called postcoital contraception. Various methods are available, and the common ones are the use-pill method, which contains 2 pills, each containing 50 micrograms of vaginal estradiol and 0.5 milligram of progesterone taken within 72 hours. And the second dose is taken 12 hours later. Same dose. You can also use levonorgestrel 0.75 milligram within 72 hours and repeated 12 hours later by another same dose. Or you can take a single dose of levonorgestrel, 1.5 milligram start. Or you can also take mifepristone, which is an antiprogestin, 600 milligram start, and it must be taken within 72 hours of unprotected intercourse. We should know that, for the emergency contraceptives, the effectiveness is just about 80%. 1 out of every 5 women who use this method, correctly will still get pregnant. So therefore, patients should be warned that taking emergency contraceptive pills does not absolutely prevent pregnancy, and such patients must be seen and reviewed at the time of their menses if it does not come, so that diagnosis of pregnancy as early as can be made should be done. Hormonal contraception for men, of course, is still a major problem. Spermatogenesis takes an average of about 74 days. High doses of drugs is required to suppress gonadotropins and completely inhibits spermatogenesis. Gonadotropin suppression results into reduction in testosterone secretion and consequently leads to loss of libido and impotence, which becomes unacceptable to men and importantly too to their wives. Drugs that have been tried include Gossipor, antiandrogens, estrogens and progestins, androgens, superactive gonadotropin releasing analogs, and cytotoxic drugs. Gossipor is extracted from cottonseed, interferes with spermatogenesis, 20 milligrams per day for initial 2-3 months, followed by 50 milligrams to 60 milligrams weekly as a maintenance dose. Fertility may be difficult to restore, hence should not be used for more than 2 years. In conclusion, hormone contraceptive is safe, highly effective at preventing pregnancy, hence it contributes to health improvement of women, especially in developing countries, and ensure that women have a safe life and enjoy their womanhood. Thank you very much for listening.